As the world enters a new phase of the pandemic, the vaccination stage, we welcome you to a new series right here at CNC3 that brings into focus the highly anticipated COVID-19 vaccination rollout, which, according to our health ministry, will begin to unfold within just a few short weeks. Now, at home and around the region, the new vaccine offers hope that we can protect our health from COVID-19, as well as improve our daily lives at home, around the Caribbean in particular. At the same time, news about the vaccine is still unfolding and frankly changing on almost a daily basis, at times causing anxiety. So now our guest, Dr. Farley Cleghorn, joins us live from Washington, D.C., where the renowned scientist is based. He is a senior scientist, epidemiologist, and what is described as an infectious diseases thought leader. He works around the world building health capacity through performance improvement. He has a lot to say about the new vaccines and is a firm believer in the benefits. Dr. Cleghorn, thank you so much for joining us. My first question to you is, the vaccine is about to roll out here in Trinidad and Tobago, highly anticipated. What benefits can we expect to see from the vaccine rollout in the short term?
Well, thank you, Francesca, for having me. It's a pleasure to be here. First of all, Trinidad and Tobago, like the rest of the Caribbean and the rest of the world, is embarking on a coronavirus vaccine program that aims to cover the majority of the population and is really the only way to get out of the pandemic as we know it today. There are other ways, of course, which would be permanently locking down the country. That is not seen as practical. The only way to truly end the pandemic and return to some semblance of normalcy is by vaccination.
Now, Dr. Cleghorn, 60,000 people, we are told, will be receiving the vaccine in the first instance. It seems like a relatively small number in the context of our national population. Can you tell how this number, 20% I believe, will improve our experience and our public health experience as it unfolds?
Sure. The 20% number actually comes out of what we refer to as the COVAX facility at the WHO. And this is a facility managed by WHO, by an organization called Gavi, which aims to support vaccinations around the world, an organization called CEPI, which aims to promote what we call epidemic preparedness. And together, they are sourcing vaccine for what we refer to as low and middle income countries around the world. And the initial tranche of these vaccines will be 20% of the population. Why 20%? Well, they have calculated that if you take all of the essential frontline workers, primarily healthcare and health worker support, shall we say, groups, then if we take that together with the people over 65 in the country, then you've got about 20% of the population. And the idea is you want to reduce the impact of coronavirus in these groups. And what is impact? Impact is disease, disability, and death. And by giving the vaccine to this initial group, you gear up for the ability to maintain your healthcare system and to keep things running until you have vaccination doses for the whole population.
So we can be assured that the pillars of our health system will be supported through this initial rollout, and subsequently the wider population may have access themselves to vaccines in different age groups. Now, let's focus directly on the vaccine. AstraZeneca is the choice for Trinidad and Tobago. As recent as just a few hours ago, there are new queries and questions about its efficacy, in particular with respect to the South African mutant. Now, can you tell us, should we in Trinidad and Tobago be concerned about that, or is this particular vaccine perfectly suited to our conditions at this time?
The answer is that it is perfectly suited to your conditions at this time. I'll make a couple of key points here. One is that variants of the coronavirus will continue to emerge. And the way that we check for this emergence is by sequencing enough of the viruses we detect in the population. And we know that sequencing of this type is going on at the University of the West Indies, for example, under Christine Carrington. So Trinidad was able to detect very early on a variant that comes out of the UK, the B117 virus. So Trinidad is doing a relatively good job of understanding what is coming into its environment. The South African variant, which we refer to as B135, this is a different variant. And as you have correctly pointed out, the AstraZeneca vaccine has been shown to have diminished efficacy against the South African variant.
Now, let me ask you, let me interrupt
Yes?
you here quickly. The issue of efficacy and whether it works in serious cases of disease very well or perhaps less so for mild cases. Can you give assurances? Because so many people here in Trinidad and Tobago want to hear information directly from a world-renowned scientist as yourself, who's also taken the vaccine, which we'll get to a bit later.
Yes.
Can you give us the assurances that the percentage of the efficacy will provide the benefits and the relief that we as a population are looking for?
Certainly. The information you referred to showing that there's diminished efficacy against coronavirus through the AstraZeneca product, that is actually for relatively mild disease. It still continued to have almost complete efficacy against severe disease and death. So in fact, when we talk about the impact of coronavirus, not simply the fact of having it, but what it can potentially do negatively to the body, then even the AstraZeneca vaccine does protect almost 100% against severe disease and death.
Now, that's a key message that we want our citizens at home and around the region to understand. And can you repeat that for us, this very specific
Certainly.
point that when it comes to cases of severe disease that may lead to death, the AstraZeneca vaccine will work very, very well in protecting people?
That is correct. That is the evidence we have today. And in fact, even for the other approved vaccines, such as Pfizer and Moderna, we actually show that there's very little impact on those vaccines. And we should, of course, be aware that Trinidad's vaccine supplies eventually will include, we think, multiple products. As the COVAX facility at WHO aims to source vaccines from different parts of the world in order to convey them to the rest of the world, then you will not only have AstraZeneca, but you're very likely to have Moderna, you're likely to have Johnson & Johnson, which is going for approval this month, and it's a single shot vaccine. We can talk about all of those products and their likely role that they're about to play in the Caribbean.
Yes, do give us a sense of the time frame that this kind of option of vaccines in large numbers may come to our region and here at home. Give us a sense of
Certainly.
what could be a timeline.
So as you know, since last January, that's January of 2020, as soon as the sequences of the novel coronavirus SARS-CoV-2, which is what we are referring to, not the first human coronavirus that we've encountered many more, but this is the one that we're dealing with. As soon as we knew the sequence of the virus, it's a relatively simple RNA virus. It has about 30,000 base pairs, we say, and we can explain what that is. But a relatively simple virus. As soon as we had those sequences, we started looking at those sequences in order to assess which parts of the virus would make good vaccines. And we have a huge repository of experience in dealing with vaccines in general, but also in dealing with coronavirus vaccines. We had been preparing for coronavirus vaccines since the original SARS epidemic of 2003-4, and since the Middle East respiratory syndrome epidemic, which started in 2011-12. And we have, as I said, tons of experience. Simply looking at the sequences, we can select the sequences from what we refer to as the conserved parts of the virus. We take those out, we put them into vaccine platforms, And it's essential here to understand that there are multiple ways of making a vaccine. And so all of these ways have been both tried, and some of them have got to the finish line. Let me explain that for a second. Starting last January of 2020, we essentially funded and we pivoted a host of research groups to work on coronavirus. It's not that all of these people were actually working on coronavirus at the time. Many HIV groups, many other virus research groups, they all pivoted and they all started working on coronavirus vaccines. This is one of the reasons for the speed that we have achieved in getting to an approved product. So essentially, we have about 150 products that are in different stages of clinical trials. And the ones that have made it to the front are the ones that have completed their phase 3 trials, because you have to go through preclinical, phase 1, phase 2, and phase 3. So the ones that have made it past phase 3 have applied for approvals. And this is an essential step as well in the process, that when you apply for approvals, you present your data. And not only does the FDA or the European FDA get hold of the data, or the UK Medicines Agency, but we, as scientists in the community, we also get hold of the data, and we do independent analyses that aim to determine if, in fact, the effect is as good as the manufacturer says it is.
Well, in terms of bringing hope to the human family, this news that 150 potential vaccines will emerge in time to really hit this problem square and straight. Tell me something, in terms of the experience of the current 3 vaccines. I know you have taken, I'm told that you have already had your 2 doses. Could you share with us so that people in our audience can get a first-hand explanation of what to expect?
Certainly. Well, I have the good fortune sometimes of living in Washington, D.C. And on January 2nd, I received a text communication from the Department of Health saying that all physicians are eligible for Pfizer or Moderna vaccines. And so I signed up, and I had my first dose on January 3rd. And the first dose was actually nothing. I felt very little. I went on with my life. I had the second dose on January 31st, because with Moderna, it's a 3-week interval between dose 1 and dose 2. I have to say that after the second dose, I had 2 to 3 days of what I call non-specific symptoms. That is, I felt a little febrile, I felt a little sick, I sort of took a nap in the afternoon, even though I was working at home. And in 3 days, it went away, and here I am, fully immunized against coronavirus. And I'm very happy to report that it works brilliantly. I intend to actually start volunteering to give the vaccine next week. So as we expand in Washington and other states of the United States, we're expanding the effort to get to more people. We need more volunteers to come into that process and help out.
In terms of your psychological relief having had the vaccine, do tell us a little bit about how you feel comparing before to your general mental well-being at this time, so that we can share some of the positive impacts of actually taking the vaccine to our citizens here in Trinidad and Tobago. Share that with us.
Certainly. Well, I was looking forward immensely to getting the vaccine. You know, I have spent 30 years of my life in infectious disease epidemiology and vaccinology. And so I am intimately familiar with how the vaccines were produced. And so I was very much looking forward to it. When I got my first dose, the first week of January, there was a huge sense of relief that a lot of people in the medical fraternity and sorority, we felt an immense sense of relief. Not only is help on the way, but also that it would take some of the burden off the healthcare system. The burden has been enormous, and it has been episodic. That is, it goes up and down. So when I got my second dose, I also felt this enormous sense of liberation. Not that it means that I can stop wearing my mask or stop social distancing or stop sanitation. Those have to continue in the short term until we get enough of the population vaccinated. And we can talk about what that proportion is. But I felt this enormous sense that not only had I done my part, but I will be able to do more given the fact that I am vaccinated and protected.
So you have a new sense of confidence and the ability to move about your life with comparative
Yes.
peace of mind as compared with before. Now, here in Trinidad and Tobago, many of the people who would receive the vaccine in the first instance, which is, well, of course, the medical profession, but also to the elderly, many of those people would have memories from their childhood of taking the very early vaccines, possibly at school, like polio and so on. So taking a modern vaccine is something entirely new. Some may take the flu vaccine, but beyond that, this is really a brand new experience, taking a 21st century vaccine. What comfort and words of encouragement and hope could you share with the elderly, some of whom are obviously looking forward to the relief of being protected, but may also have some doubts about how the process will unfold for them, especially when compared to the fact that it might be many decades since they took a vaccine before?
Sure. Well, Francesca, we, as part of looking after the health of families and individuals, we talk about vaccines in a lifestyle manner. So what you have described is many people are very familiar with what we call the expanded program of childhood immunization. So you get a lot of vaccines when you're very young because it prevents death and disability both in childhood and continuing into adulthood. But we also have a set of vaccines we call the stages of life vaccines that we recommend for people over the age of 60. And two of them I have already taken because guess what? I'm going to be 62 this year. And the fact is, as soon as I turned 60, I got two vaccines that are part of the normal healthy person schedule. And one is the shingles vaccine, and the other is the pneumococcus vaccine, which prevents pneumonia as you get older. And so to me, this is a third vaccine that I have had to take since the age of 60, no problem. But in many countries like Trinidad and parts of the Caribbean, we are still adding those, what I call stages of life vaccines for people over the age of 60. So you're absolutely right. Many people in Trinidad would not have had the experience of going to their doctor and them saying, you're a healthy 60-plus-year-old, you need to take pneumococcus vaccine and you need to take the shingles vaccine. So that is going to come in the future for Trinidad.
So for many of our citizens who are, let's say, over the age of 60, taking a vaccine at the later stage of life, as you call it, would be something entirely new and
Yes.
very important. So could you frame how important this is for that age group at this time?
Certainly. If we are speaking to preventing or mitigating the impact of coronavirus, what do we see? We see that there is a greater morbidity and mortality as you get older. And you also see a greater morbidity and mortality, that is sickness and death, for people who have what we call pre-existing conditions. And those conditions are very common conditions, such as diabetes, hypertension, chronic kidney disease, chronic heart disease. All of these people, and there are many such people in Trinidad, they're under good management, so they're doing pretty well. But if they got coronavirus, then their likelihood of having more severe disease and their chances of death are actually higher. So it's extremely important to get this preventive vaccine so that if they encounter coronavirus, it's not necessarily going to stop them from becoming infected, but it will stop the infection from doing its dirty work, which is death and disability.
So what we're saying with the AstraZeneca vaccine is that the effect of the vaccine will be to protect you from the most severe manifestations of the disease. And that really is what we are looking for to prevent death. Now, we've spoken earlier about the impact of 20% of the population being vaccinated. You've given us a lot of hope in terms of the number of vaccines, up to 150, that will roll out in the coming months and maybe a couple of years, which will eventually impact on the entire human population. Can you bring us back home a little bit and give us a picture of what might be the next steps in Trinidad and Tobago after this initial rollout? Can we expect within a couple of months a second wave of vaccines or not?
Well, I see three related steps. One is, as we've mentioned, the COVAX facility at WHO, giving you 20% of the population, which is approximately 60,000 people, getting 120,000 doses, since each one will require 2. As more vaccines are approved, there are 2 other mechanisms that Trinidad can use. One is to go directly to companies and to purchase vaccines. There are mechanisms to do that, and only national governments can purchase vaccines at this point. So the Trinidad government, either acting on its own or going through what we would call a purchasing facility. So if CARICOM decided, for example, to buy vaccines for the rest of the region, then Trinidad can be part of that. But this would be direct purchasing, either advanced purchasing or actual sourcing.
Now, where you sit in the United States, you have a very global view of how the pandemic is unfolding. You've had long experience in the HIV pandemic and others, SARS, MERS, and so on. Could you give us an actual sense, a pulse, so to speak, on where we are in the Caribbean as compared with other parts of the world?
Yeah. Well, as it turns out, you're not in a bad place. There are a couple of reasons for that. One is that the populations of the Caribbean are relatively young. That is, average age is in the early 20s, whereas the average age in the part of the United States where I live is about 40. And that makes a huge difference when coronavirus sweeps through the population. You have much more disease and disability with older populations. Then the second thing you have going for you is that the Caribbean is a series of islands, and islands are hard borders, we say. That is, you can shut down that border. And very many countries in the region and other islands around the world have actually done exactly that. So once you stop incoming flights and incoming transportation, then you have a much better handle on how the virus will enter the population. And by a good testing program, you can understand how that is happening. So 2 things going for the Caribbean. And then you have a third thing going for you, which is that the Caribbean public health agencies within government and outside of government, they're actually quite good. And so what we have seen in the Caribbean are relatively small epidemics with relatively low death rates. And in order to keep it that way, the final step will be to vaccinate those populations.
You're giving us a very positive sense of how the Caribbean has managed the pandemic so far. And now that we're on the eve, the cusp of the first rollout of the AstraZeneca vaccine, of course, more hope comes to our shores. As we close, Dr. Cleghorn, can you give us one important message, the key message of our discussion over the last 30 minutes or so that you would like to send to citizens of Trinidad and Tobago on the eve of the rollout of the AstraZeneca vaccine right here?
I would like to say to the peoples of Trinidad and Tobago and to the Caribbean in general, that you have been leaders in public health in the past and in the present. And I see no reason why you won't continue to be leaders in that all of the questions and concerns about vaccine hesitancy, about the fact that these vaccines were developed very quickly, all of these actually have great explanations We have very safe products that will prevent disease and death, and you guys will lead the world in uptake of those products.
Dr. Cleghorn, thank you so much for joining us and giving us your cutting-edge worldview, a thought leader, medical thought leader, as you have been referred to, in showing us some of the positives and the future, the hopeful future for the Caribbean as we continue to manage the pandemic in 2021. Thank you so much.
Thank you, Francesca. It's been a pleasure.